A globally distributed paradigm shift for cannabis and hemp. Cannabis sativa, paradigm shifts and paradigm shift drivers. The Canadian experience. Cannabis sativa. The molecules in cannabis and hemp are anti-aging molecules, safe and efficacious industrial hemp, cannabinoid ghosting technology, CBDT. Futurist and founder, CTO of Lifespan Research Incorporated, from Canada, Morris Johnson.
Hello, CISW. Since 2010, when I addressed the Humanity Plus Harvard Conference, Rise of the Citizen Scientist, I've had the vision of a convergence of wellness and lifespan extension technology paradigm shifts together with hemp. I will detail how these global paradigm shifts are becoming a reality. Over 20 years, Canada has built a growing hemp industry. These paradigm shifts can turn a wandering curve into a constant upward trending long-term sustainable growth line. We in Canada have built a robust canola, lentil pea, and canary seed set of supply chains. Let's examine the steps to repeat this legacy success story with hemp. Remember that what we pioneer in Canada can be replicated globally. Paradigm shifts can appear to be instant, radical change, but in reality, for your reference, here are the steps typical of the process of shifting a paradigm. 4 paradigms are in the process of shifting. 1 is the longevity industry. 2, personalized, deregulated, personally directed medicine. 3, global health crises, such as we're experiencing with COVID-19. 4, evolving applications for cannabis bioactives. So essentially, the key buzzword is hemp empowers all of these paradigms. Key global disruptor of the economy is not disease. It's the underlying biological processes that underlie aging or the process of aging itself. Capital markets have been pretty quick to pick up on this and have analyzed the emerging longevity industry and have a game plan to make it worth tens of trillions of dollars a year, ramping up over a very short time frame with a continued long-term growth curve to follow. Quality adjusted life years, sometimes called QALY, are a metric which equates $50,000 to $150,000 to represent the market value of a year of life in perfect health. This is the economic threshold or barrier to creating and making widely available novel wellness and lifespan extension technologies. Derivatives valued in the tens to hundreds of trillions of dollars are deeply involved in driving the pace at which this industry deploys itself globally. So here are the nuts and bolts. These, okay, there's explanation for that. Here are the nuts and bolts as to elaborating how to transition from a $285 billion to a $2.8 trillion market value set of supply chains, not including the spin-off supply chains or economic multipliers. And this is actually what supports pro-longevity and public policy development related to that. Biohacking is a new term in the 21st century. Health consumerism emerging as a critical driver for increased hemp consumption. Deregulation of procedures and substances consumption is securing for hemp bioactives opportunities to be put the best science-based biomedical purposes to work. Now, hemp is composed of an entourage of small molecules. These are matched to the biological drivers of aging and thus modulation of resultant disease as we compartmentalize aging processes into manageable health outcomes. What are described as the 11 deadly sins of biology can all or in great measure be impacted positively by molecules found in hemp. So this may be a bit of a radical idea, but COVID-19 is actually a blessing to the hemp industry. And why would that be? Well, the full bioactive complement of hemp materials, when used in combination with a dozen other food, nutraceutical, prescriptive, usually readily available, and usually very safe, in my opinion, materials, when used prophylactically as well as after infection, actually may reduce the global pandemic to a much less terrible disease, more like a flu than a killer disease. So multiple complementary modes of protection are detailed in published and pre-published research documents, and the bioactives of hemp are featured in those. Fortunately for hemp, the field of artificial intelligence is now a driver to matching molecules to the science of the fight to slow and reverse aging. For example, in silico medicine took 26 days recently to develop a drug design project or complete it, which sometimes would take 1 to 5 years. So Moore's law of accelerating returns now drives the drug discovery pipeline. Hemp bioactives can now be readily integrated into functional small molecule combinations in very, very short periods of time. Fierce discussion over the safety and efficacy of hemp bioactives has raged as if it were one of these medical aging processes termed inflammaging. There are terms called statistical deception that have been used in some cases for other drugs to make drugs that are higher risk appear less risky. A term called allometric scaling has been used in a peer-reviewed paper to make CBD appear to be a drug that could be quite dangerous to human health. But when you review the total science package, you'll find that allometric scaling is totally incorrect in how it is presented, as the very danger that it purports for CBD turns out to be, in fact, a regenerative or therapeutic characteristic of CBD. Likewise, the P450 argument as being a risk or a straw man is to the sophisticated health consumer just another parameter that they use in gauging how they use CBD to get their overall health outcomes. It's not something that should be ignored, but it is something that actually is useful as well as a compounding factor. So, how do we put simplicity into delivering results? Well, the little organization or company that I'm involved in, Lifespan Research, processes milled what's called whole bioactive spectrum bin-run hemp grain into a bioreactor fermentation slurry from which liquid and solid hemp derivatives emerge to incorporate into food, nutraceutical, and prescriptive, and reminiscent of the polypill, which was a multi-nutraceutical pharmaceutical prescription product, hemp derivative, bioactive embodying formulations. So this is something which is very controversial, but I'll bring it up anyway. Consider the notion of avoiding regulation of the hemp cannabinoids by ghosting the THC and most other cannabinoids through bioprocessing. If you zero out the measurable cannabinoids in the derivatives from the time they leave the field to the time after they're consumed and regenerated in people after consumption, you eliminate some regulatory constraints. And this has happened already in the nutraceutical industry. Vitamin E is an example where D-alpha tocopherol acetate is consumed, but vitamin E is what it is converted into after you digest it. So this is a way to avoid being regulatorily constrained in the way you deal with hemp bioactives. In Canada, the foregoing is a mission critical act in that the Cannabis Act and C-45 deny the addition of the licensed producer cannabinoids into fresh or prepared meat products. So many Canadians consume 200 or more pounds of meat per year, which are an excellent way of putting hemp bioactives into the food supply. So this, in some ways, is intellectual property and trade secret protected, but it's not rocket science, but it does enable a much more regulated or deregulated mass market for grocery store consumers. So this, what you call generifies mass consumption, and it's a model that can be duplicated in most other countries. So we in Canada now grow and harvest hemp and process it just like any other agricultural crop commodity, like I talked about earlier, into value-added commodities. The economies of scale of modern agriculture substitute in many cases for the high-cost legacy cannabis bioactive supply chain technologies. Not that they don't have specific and very important ways of producing very targeted materials, but for the mass consumer, this is indeed faster, better, cheaper. So here's a demonstration of a generic presentation of what I term canterpene bioderivatives, a family of hemp derivatives, commercial ingredients, efficacious, deregulated, affordable, and very simple to incorporate into food products. And this is not the only technology out there that is not widely used or known about. Other technologies suited to commercial scale batches of a few tons at a time of custom compounded, what I call CBD tea or CBD technology, hemp containing foods, nutraceuticals, and polypill-like prescriptive products existed. 18 months ago, I toured a Chiang Mai, Thailand facility of Thai Freeze Dry, which converts raw materials into nanoparticularized, ultra-dry, flowable, multi-component powders. Now, a disclaimer is that I have no financial ties to this company, but I would like to use it as an example of players who can extend CBD tea into a broad range of products. So where do we go from here? Well, consider the rapeseed to canola story from Canada. Hemp has struggled to differentiate itself from marijuana for very many decades. So perhaps just as with canola, the solution is actually hidden right in plain sight. Let me suggest a solution. Focus on lifespan versus health claims. I used an isoprene bioactive building molecule and a Canadian maple leaf and a brand new name, canterpene, Canadian source of terpenes, flavonoids, and cannabinoids. So this would be our idea of a representation of rebranding hemp into a mass market idea that translates a number of things visually. So if you wish to Google the terms SlideShare and canterpene plus my name, Morris Johnson, you might see how all this has evolved over the last 45 years that I've been involved in the nutraceutical industry. Now, I would like you now to the audience to tell me how these paradigm shifts can be expanded upon and how the hemp industry can achieve the economic targets that I detailed. And $3 trillion is a very large number. But when you do the metrics, it's composed of the consolidation of some very small numbers. So at this point, if you would like to provide me with some questions, I've tried to keep my presentation as brief as possible so that I could entertain your questions.
Okay, thank you so much for your presentation, Mr. Johnson. We look forward to hearing more from you in tonight's discussion panel. Thank you so much.
Thank you much.
Thank you.